Could a full reopening come sooner than late March?
I think there's a strong possibility for that. If anything, things are moving very quickly. Just to give you an example, now we're looking to set up meetings in person for next week. So things are moving fairly quickly. And if you look at the data is looking fairly favorable. When you saw that spike in number of cases in China, there wasn't a spike in symptomatic cases. The spike was primarily in asymptomatic cases, the point where 90% of the cases were asymptomatic, right? So the data is looking fairly favorable, and things are moving fairly quickly across the country. There's another very important factor that I think is not taken into consideration here, which is while protests were an important catalyst, the other very important catalyst, probably even more important catalyst, is the cost of doing these tests. To give you an example, here in Beijing for 2022, the average Beijinger got 50 tests. It is fairly cost prohibitive, and social insurance funds are running out of money. So that's the reason why you're seeing the test booths shut down earlier than the actual requirements to get tested. So that is another very important catalyst to take into consideration.
Yeah, I'm glad you mentioned that, Sam, because I wanted to know how much of an influence really the protests have had on the leadership in terms of the acceleration of these easing of curbs, because they had already announced that the 20 measures prior to the protests. But then, of course, we saw this demonstration of public opinion, as they're calling it over in China. And the way it's certainly been characterized in Western media is that they are sort of giving in to the protesters. But that's certainly not how the leadership would like it to be characterized, right?
Yeah, well, there's no doubt about it that the protests did have an effect. But I would say the financial strain that I just mentioned had an even bigger effect, in my personal view, right? And if you notice the protesters, you're going to notice that they're younger, they're more educated, but there are two other demographics that the government is just as concerned about. Number one is obviously the elderly. There's 250 million over 60 in China, which is almost 3/4 the population of the U.S. But then there's also the rural and the less educated who are extremely leery about this disease and the potential for them to get the proper care given how poor care is in the rural areas, right? So the government also has to take into consideration those two other segments that are fairly sizable segments.